Hi, my name is Benim Nofra and I work as a policy officer at PACT and want to welcome you to the Partners Assembly 2022 presentation. Let us go through the agenda for this presentation. We'll start by giving you an overview of the reports and activities that were implemented in 2021. Then we will discuss the PACT Work Plan 2022. Lastly, the collective priorities, activities, and objectives during 2022 will be discussed. So let us start with the core project activities that PACT has conducted during 2021. Here you have an overview of the MEP activities that we had in 2021. And as you can see, most of them were virtual due to COVID. The first meeting occurred in January 2021, which was an internal strategic meeting that was about discussing and giving feedback on the priorities that PACT needs to focus on in the near future. The MEP interest group also discussed the EU COVID-19 response and what effect it has on equitable access. The next event was in April 2021 and focused on the theme turning principles into a reality of more equitable healthcare. Lastly, there was another virtual event in December 2021 titled The Recovery and Resilience Facility in Enhancing Equitable Access to Healthcare, Examining a New Paradigm. We will now discuss each of the activities mentioned above more in detail. As previously mentioned, the first working meeting involved setting strategic priorities and a working agenda for 2021 and beyond. Next was the webinar that highlighted that the HSPA report on measuring access had been published, that the European semester 2021 should be seen as leverage in relation to this topic. Other points that were made during this webinar was that social determinants are underlying cause of access issues and that having an action plan on pillar of social rights is in the best interest of all. The next webinar was just before 2022, and the main takeaway from the event was that significant healthcare improvement can be achieved through the RRF with consistent and coherent application of health-related corporate social responsibilities. The next point that was made was that the transformation of funds into results, it was asserted, can only be achieved through cooperation between governance levels, systematic stakeholder involvement, and capacity building practices. Next on the agenda is the PACT projects that were implemented during 2021. The Model Access Solution was established as a way to aim, identify, and promote selected evidence-based, workable solutions for better access to healthcare. The overall goal is to provide member states and different stakeholders with a web-based repository of models of excellence in the field of access, supplemented by a dedicated workshop to explore how they can be replicated by stakeholders and or scaled on a local, regional, or national level in other EU member states. Here you have the advisory board members of the Model Access Solutions project of PACT that was shown in the previous slide. The Model Access Solutions had 4 important activities during 2021. The first event was a webinar in April that consisted of a working session with all advisory board members of the Model Access Solutions project. The next activity was the proposal submissions between May and November 2021. There was a call for initiative which provided equity of access along the core pathway for patients with chronic conditions at times of major public health challenges such as the COVID-19 pandemic. After that period, there was a second webinar in March that consisted of a working session with all of the advisory board members we showed in the previous slide. Lastly, between April and May, there was an evaluation process of the submitted proposals that the advisory board members evaluated. Out of the 8 submitted projects, 7 of them were accepted. During the Model Access Solutions initiative, there was also various means of communication and dissemination activities performed, among which graphic identity of the project and promotional video, active Twitter campaign, dedicated section on PACT websites, meeting with partners, and other. There was also a push for the Model Access Solutions initiatives, receiving awareness through our website and media coverage so that a broad network of stakeholders are aware of them. Now we will discuss the PACT Work Plan 2022. Here you have an overview of the work plan that was focusing on consolidating by having 2 thematic meetings with the MEP interest group on access, an exchange of ideas through the Model Access Solutions initiative, and lastly cooperation in the Partners Assembly session and the dialogue-oriented webinars that we previously mentioned. Here you have Pillar 1 that addresses coordination, governance, partnership, and financial viability. The objective of this pillar is to promote access high on the agenda through regular meetings and topical statements of the MEP interest group on equitable access to healthcare. And we aim to achieve these objectives by having at least 2 thematic multi-stakeholder meetings of strategic priority to all co-chairs of the MEP interest group in line with the agenda of the current EU presidency trio. You can find the deliverables at the third point, and the general aims are policy attention and visibility. The second pillar focuses on institutional relationships through the objective of maintaining close collaboration on the issue of equitable access with health initiatives in relevant EU institutions, including the European Commission and the EU Council presidencies. This objective was going to be achieved by involving representatives of each EU presidency, relevant directorates and/or specialized agencies in the thematic meeting with the co-chairs of the MEP interest group. In the slide, you can see the target audience, and the general aims are intersectoral approach, better outcomes, and sustainability. Pillar 3 addresses solutions mode through the objective of raising awareness on sustainable access-related initiatives that carry significant potential for replication and scaling through the Model Access Solutions initiative. The activity to achieve this was through advancing and finalizing Cycle 1 of the Model Access Solutions project. The third point explains the milestones. The general aims were to gain recognition, visibility, discussion on scalability, and policy attention. The fourth pillar is about synergies with other initiatives by having the objective of strengthening PACT's governance, basing ourselves on lessons learned from the pandemic in the long term. This was going to be achieved through organizing a collaborative session in the context of the Partners Assembly for alignment and consistency, seeking priorities for 2023 and beyond. The third point brings up the deliverables, and the general aims were to have an agreement on common priorities and joint action initiatives, avoid duplication, have visibility, and policy attention. And now we will discuss the dialogue-oriented webinars that PACT had. In 2022, PACT arranged a Time to Act webinar series that had the objective to prioritize and consolidate the relationship with PACT partners on access-related topics of mutual interest and significance. The webinar series was launched in March, and the first theme was The Future of Health, Time to Act 2022, which was about future-proofing healthcare. The first webinar occurred in September and focused on skills and education to mitigate the migration of healthcare workforce and brain drain. The second webinar that took place in November was about equitable digital transformation of health systems. In January 2023, the third webinar about health and well-being as a prerogative across all EU policies will occur. The fourth webinar is planned to take place in April 2023 and is about leaving no one behind. The last slide is about the wider impact that the work plan wants to highlight. One of them is having the in-depth discussions on key priority areas. Another one is creating impactful recommendations for future actions. The third one is to translate EU debates into local strategies. Fourth is to engage with EU and national policymakers. Fifth is visibility and showcasing our work. And sixth is to tailor more narrow company-specific priorities. Thank you for your attention, and see you soon.